Another key term in today's study session is narcissistic personality disorder. Narcissistic personality disorder is a cluster B disorder characterized by a sense of grandiosity, lack of empathy, and an excessive need for others' approval and respect. In order to receive a diagnosis of narcissistic personality disorder, an individual must display at least 5 of the following 9 symptoms: exaggerated sense of self-importance or feelings of superiority, preoccupation with ideas of unlimited success, power, brilliance, beauty, or ideal love, a belief that because of his or her own uniqueness, it is appropriate only to associate with other special people, extreme need for admiration, a sense of entitlement, the exploitation of others in order to reach his or her own goals, a lack of empathy. The person is also often envious of others or assumes others are envious of him or her, and demonstrates arrogant or haughty attitudes and behaviors. These symptoms must be present beginning in the early adulthood years and in a variety of contexts, and constitutes an enduring and inflexible pattern of inner experience and behavior that is significantly different from the expectations of the individual's culture. Although individuals with narcissistic personality disorder appear confident and self-assured, some research contends that their self-esteem is actually very fragile. Criticism often leaves them feeling humiliated and empty inside. In order to defend against these unpleasant emotions, they may react to criticism with patronization, disdain, or with rage. In other words, the feelings of superiority and specialness appear to be compensating for a lack of self-worth at the individual's core. Individuals with narcissistic personality disorder are vulnerable to developing persistent depressive disorder, which is previously known as dysthymic disorder, or major depressive disorder, especially upon reaching middle age. Other associated disorders include anorexia nervosa, substance abuse disorders, particularly cocaine use, antisocial personality disorder, borderline personality disorder, histrionic personality disorder, and paranoid personality disorder. Individuals with narcissistic personality disorder have difficulty recognizing and understanding the needs and viewpoints of others. They often devalue others' contributions, overestimating the importance or noteworthiness of their own actions and talents. Individuals with this disorder may take advantage of others in order to meet their own goals. They also expect others to recognize their specialness and thus comply with their every wish. Indeed, they often feel quite entitled, believing that they are owed special favors or opportunities, and responding with anger and dismay when their needs are not met immediately, and their self-perceived unique talents are not recognized. Individuals with this disorder may take advantage of others in order to meet their own needs. They also expect others to recognize their specialness and thus comply with their every wish. Indeed, they often feel quite entitled, believing that they are owed special favors or opportunities, and responding with anger and dismay when their needs are not met immediately and their self-perceived unique talents are not recognized. The etiology of narcissistic personality disorder is generally believed to be rooted in childhood, although there are differing opinions on the specific mechanisms through which the disorder develops. Otto Kernberg, for example, theorizes that narcissism develops as a response to an unempathetic and unresponsive caregiver. Narcissists generalize their feelings about their caregivers to the outside world, which is viewed as rejecting and an entity that needs to be fought against. The grandiosity and desire for recognition inherent in the narcissistic personality disorder are then defenses against feelings of worthlessness and emptiness caused by the caregiver, who valued them for their skills or looks but not their own developing selves. Heinz Kohut, on the other hand, sees this disorder as a form of arrested development rather than a maladaptive defense mechanism. Kohut posits that grandiosity is developmentally appropriate in young children. However, if a caregiver neglects to provide a realistic representation of self for the child, the grandiosity remains, and the child does not learn social values, for example, empathy or reciprocity, continuing to overestimate his or her own talents and contributions in a kind of extension of a far younger developmental pattern. Treatment for narcissistic personality disorder focuses on the individual's grandiosity and their underlying fragility, and gaining a more realistic perception of the self and of the world. Relaxation techniques may be employed to combat the severe anxiety that accompanies criticism. Treatment of this disorder may also assist the individual with gaining empathy and respect for others. Less than 1% of the general population is diagnosed with narcissistic personality disorder. The prevalence rate in clinical samples ranges from about 2% to 16%. An admittedly wide range, bespeaking some diagnostic uncertainty regarding the access to disorders. And lastly, between 50 and 75% of those with this disorder are male. Let's practice with a question for narcissistic personality disorder. George is not well liked by his coworkers. He takes credit for any success within his department, ignoring the contributions that are made by his peers. He is flabbergasted when people fail to recognize his superior skills and responds with anger if he is criticized. He is not aversive to taking advantage of others if it is to help him accomplish his own goals. Whenever there is a company luncheon, George spends most of his time bragging about his accomplishments to his CEO. George would most likely be receiving a diagnosis of answer A, antisocial personality disorder, answer B, histrionic personality disorder, C, narcissistic personality disorder, or D, borderline personality disorder. The correct answer is C, as the descriptions are explanatory of the diagnostic criteria required for narcissistic personality disorder. Antisocial personality disorder, which is answer A, is a cluster B personality disorder characterized by a pervasive pattern of disregard for and violation of the rights of others. Histrionic personality disorder is characterized by extreme emotionality and attention-seeking behavior. Borderline personality disorder, answer D, is also a cluster B personality disorder, but is characterized by a pervasive pattern of instability of interpersonal relationships, self-image, affects, and marked impulsiveness. We invite you to participate in the next chapter of our series on the key term areas affected by the DSM-5. Thanks for joining us.